Welcome back. I think that was just such a fantastic presentation this morning by Dr. Williams, and I'm looking forward to more exciting and informational sessions coming up. Our next speaker is Dr. Beth DuPree. Dr. DuPree is a surgeon, author, and patient advocate. She's the medical director of the Breast Health Program at Holy Redeemer Health System in Huntington Valley, Pennsylvania, where she developed an innovative setting for the diagnosis, treatment, and healing for patients with breast disease. The facility combines state-of-the-art medical care with Eastern healing philosophies to treat the whole patient. Dr. DuPree leads this practice, comprehensive breast care surgeons, and is a fellow of the American College of Surgeons, an American Board of Surgery diplomat, and chairman of Advocates for American Society of Breast Surgeons. She also serves on the advisory board for breastcancer.org, Susan G. Komen, and the Gildas Club. Dr. DuPree earned her medical degree from Hahnemann University and completed her general surgery residency at the Albert Einstein Medical Center. Dr. DuPree established the Healing Consciousness Foundation to fund holistic and wellness therapies that heal the mind, body, and spirit for breast cancer patients. You guys might also notice I'm decked out in pink in recognition of Breast Cancer Awareness Month. Dr. DuPree is a prominent speaker at the national and international events. In her book, she describes her journey to combine Eastern and Western medicine. Her focus on holistic healing and balanced energy has earned her numerous humanitarian and medical awards. We're delighted to have Dr. DuPree with us today. Please welcome Dr. Beth DuPree.
They asked me if I was going to take the whole hour, and I have never taken less time than I was given, so I hope you have a cup of coffee so you get to be comfortable. I have to do my faculty disclosures first, because I do teach and speak and educate, because in addition to what I'm going to talk to you about today, which is really my passion, which is healing, I also work to educate surgeons and radiologists to do minimally invasive biopsies, use state-of-the-art technology. And I say that first because I want you to understand that my background is in Western medicine. I was trained in, the best of the best. Learned everything I could about Western medicine, and it was only through my journey that I came to a place today where I can talk to you about healing. And that's what it's all about. And so today, my goal is, because most of you in this room have not experienced cancer, God willing, except for treating your patients, I want to give you some insight into what we as care providers need to know about our patients as they go through this journey. And last week I gave a very similar talk, and afterwards a medical oncologist came up to me and said, Dr. DuPree, when were you diagnosed? I said, I've never had cancer. And she said, I can't believe it. How could you have such perspective? And how do you have this innate knowledge about what patients need on this journey? And my answer was simple. I pay attention. I pay attention to the needs of my patients, and when I'm done treating their cancer physically, that's just the beginning. So this is a journey, and along the journey, all of us, whether you've had cancer or not, whether you're a care provider, a patient, or a loved one or a family member, we all experience adversity. And adversity in our lives is what allows us to really grow as spiritual beings. And I was interviewed last week, and someone said to me, well, when did that start for you? And my adversity in my life that really changed me forever happened 33 years ago this past Friday. It was 33 years since my 27-year-old brother was killed by a drunk driver. And although I've never had cancer, that was a kick in my gut that I could not even imagine the amount of pain that you can feel. And so when a patient's diagnosed with breast cancer, that's my only time in my life that I could even imagine how incredibly painful and fearful that diagnosis can be. And although it's been 33 years, it's still very fresh. I never stopped thinking about my brother, but what I do is I've decided that through that adversity I had choices to make in my life about how I move forward and how I care for my patients and how I can empathize with my patients. So, have any of you ever felt adversity? It doesn't have to be cancer, but because you work in the radiation oncology field, clearly the patients are coming to you for treatment of some form of cancer, most likely. And cancer is one of those diagnoses that when it hits, it really hits hard. And my goal today is to help you gain some understanding and some perspective of what our patients are going through when they come in to see us. And so cancer changes a life. It changes the patient's life, it changes their family's life, it changes how their children feel and think, and it changes how we feel as well, because we see patients coming and going through our practice. And I have patients through the entire spectrum, from diagnosis to treatment, and sometimes to transition when they don't win that battle with breast cancer. And because of that, I see patients the whole way along the journey. Many of you only see the patients during treatment, but you have a great role to play during that process of treatment, because our patients are only with us for that short period of time, but they are hurting emotionally, physically, and spiritually. And so we have a great opportunity as care providers to make this journey better. And the most important thing to know about your patients when they're diagnosed is that they are fearful. They're fearful that they're not going to wake up the next day. For many women and men, it's the first time in their lives that they don't think about tomorrow being guaranteed. Suddenly they feel their mortality, and they're paralyzed. And the paralysis that comes from the fear oftentimes keeps them from being able to live fully in the moment. It keeps them from being able to think about the positive things in their life, because they're holding on, they're scared, and they don't know what to do. So one of the things we can do is empower them with knowledge. And sometimes it's as much as, taking them on a tour of our facility to make them understand that they're not going to be alone. Even if they're in the room, you're still there with them. You may just be behind a wall. Letting them know that they're not going to be alone on this journey. Listening to their concerns. Not having to know exactly what to say, but let them talk to you and hear their concerns. We educate with knowledge. I am very proactive with my patients, and when my patients are diagnosed with breast cancer, I always have them visit the radiation oncology department prior to making a decision about their treatment options. Because the last thing I want is to have them have more fear as they move forward. Once they get through surgery, if then they're paralyzed with fear, what's radiation going to be like? We've made it a practice in our practice to make sure that our patients visit the radiation oncology department, meet the radiation oncologist, understand what the journey is going to be like, because that knowledge helps to bring that fear down another notch. So the first thing our patients say, am I going to die? They come to my office, and I'm sure they'll ask the same thing of the rad-oncs, and they may ask the same thing of you, because you're treating them. And the answer is simple: we're all going to die. And I do have a very important message. If you knew when you were going to die, you would live your life very differently. If you knew that you had 300 days left in your life, suddenly your priorities are going to change. But in all honesty, none of us know when we're going to die. The night that I had dinner with my brother was my sister's birthday. And he left our parents' house, and he actually got there late for dinner that night. He was a flight instructor, and he was teaching a young doctor how to fly. And for any of you that fly, you'll know that when you take off an airplane, it's one of the most difficult times to lose an engine, because you don't have the lift to be able to get back to the airport. And that day, my brother lost an engine on takeoff. He was able to get the plane back, get it on the ground, kind of crack the wheel, so they got on the ground safely. But he came to dinner that night and said to my mom, he said, "Mom, listen, today my number was up. But I said to God, I have to get to dinner, or my mom is really going to be pissed off at me." And so we sat at dinner, and it was really a gift to us, because we were able to sit there and kind of talk about mortality without knowing that when he left my parents' house, he wasn't going to make it home. And so, to me, that gave me a tremendous amount of closure, because he actually talked to us about what he wanted to do. If he died, he didn't want to be buried. He wanted his ashes spread out of an airplane in bad weather flying to Peoria, Illinois, because he used to do that when he was a young pilot. But it was that message. I mean, if you know when you're going to die, you're going to live your life very differently. But I always tell my patients, my crystal ball is broken. I actually have a crystal ball because I've used it so many times. Somebody finally gave me a crystal ball, and it sits on my desk. So I point over to the crystal ball and I say to my patients, my crystal ball cannot tell me what your fate is going to be. I've had patients diagnosed with breast cancer change their life. They live it very differently, only to have their husband die of a heart issue or something in short order. And they say what a gift the cancer was, because it changed how they lived those 3 months prior to that time.